Welcome to the Center for Healthy Communities series. It's L.I.T, Learning, Informing, Teaching. Here we try to explain concepts that you may want a bit more clarity on. Today we have a special episode. We will be going over health policies. So let's go ahead and get started. So what are health policies? A policy is a regulation or law that the government and other institutions pass. Regarding public health, policies are established to influence change within systems or individual behavior that promote improvements in health nationwide. These policies can be passed at either a local, state, or federal level. Health policies have a major impact on the health and well-being of a community and an individual. The importance of health policies includes developing partnerships, better use of resources, and communicating findings that allow issues to be addressed. Now, let's take a deeper look at two different health acts established to reform policies. First, we have the Health Equity and Accountability Act. This piece of legislation was created in order to ensure that communities facing health disparities have access to health services needed in order to live healthy lives. This act has the goal of reforming policies and expanding federal health resources for ethnic and racial minorities who face barriers to care due to their immigration status, sex, sexual orientation, gender identity, and English proficiency. One example can include doing more research and education programs on the effects diabetes has on minority communities. The research can look into genetic, behavioral, and environmental factors that put minority individuals at higher risk of getting this disease compared to others. This will then result in more community-based interventions discussing diabetes and pre-diabetes prevention with minority groups. All these provisions will result in shutting down health disparities and improve the well-being of communities in the United States. Next, we have the Improving Social Determinants of Health Act of 2020, established to improve health outcomes, reduce health inequities, and have better capacity of health agencies or community organizations using the social determinants of health. Other goals include coordinating across the CDC to ensure programs consider and incorporate social determinants of health in grants and activities, awarding grants to state, local, territorial, and tribal health agencies and organizations to address social determinants of health in target communities, and awarding grants to nonprofit organizations and institutions of higher education to conduct research on social determinants of health best practices. With the grants and activities, health agencies or organizations are required to provide quantifiable data about the gaps within health that promote the social, economic, and environmental needs of the community. These needs might include inadequate housing or lack of food. When finding the gaps, then organizations and agencies would come together to create intervention systems addressing the needs of the community. Overall, these acts are essential to improve the health of underserved communities all over the United States. All information regarding health bills can be found on the congress.gov website. Thank you for watching, and please subscribe to the Center for Healthy Communities YouTube channel to learn more.